Brain fog is a symptom. Brain fog isn't a diagnosis. And just like every other symptom, like dizziness or headache, there's a reason. There's so much that we should know, so little that we're feeling. A lot of times, decline is silent until it's not. High blood pressure is a silent problem, slowly and gradually eroding our arteries over time. And eventually, there's going to be a tipping point. None of that. The landscape has gotten a little noisy. The answer is the fundamentals. Eating the right things. We should be moving our bodies in the right ways. We should be sleeping enough. And we should be attending to our stress and our mental, emotional well-being.
According to the CDC, stroke death rates for Black women between 45 and 64 are 2 to 5 times higher than any other group in the country. With us knowing these numbers, why are we still declining? Every 40 seconds, someone in the United States has a stroke, and Black women are among the most vulnerable. Stroke death rates for Black women between the ages of 45 and 64 are 2 to 5 times higher than for any other group in this country. Not slightly higher, 2 to 5 times. And it doesn't stop there. Black Americans are twice as likely to develop Alzheimer's disease. Black women represent the largest share of unpaid dementia caregivers in America, often sacrificing their own brain health while carrying everyone else's. We are living in a brain health crisis, and most of us don't even know it yet. Today, I'm sitting down with Dr. Kimberly Idoko of Everwell Neuro to talk about what is actually happening inside our brains, what we can do about it, and why protecting your brain health right now is one of the most powerful acts of self-preservation a Black woman can make. Your brain is not separate from your body. It is the command center of everything. If this is the kind of conversation you need in your life, subscribe and follow so you never miss an episode. This is the Lushness podcast. Let's get into it. Dr. Idoko, welcome to the Lushness podcast. I'm so happy to have you today because, man, when do we ever get a neurologist, right, to have a conversation to talk with? So thank you for being here.
Thanks for having me. Appreciate the invitation.
Perfect. So, okay, I want to start statistics first, as always, because we always want to ground our conversations in science. So according to the CDC, stroke death rates for Black women between 45 and 64 are 2 to 5 times higher than any other group in the country. And we're also prone to Alzheimer's disease much quicker than everyone else. So the question is, with us knowing these numbers, why are we still declining?
Why are the stroke deaths still increasing, and why is the prevalence of dementia among Black people still outpacing that of others? I mean, there are myriad reasons, and it's a matter of opinion, right? Because there's no real data that's going to be specific in answering that question. But it's a matter of a few things, including lifestyle, including what we call comorbidities, or those underlying risk factors that are more prevalent among Black people, Black women for stroke, and Black people generally for dementia. And those really are the biggest reasons.
Wow. Yeah, because what I noticed is that even doing the research, no one knows the answers why. It's always just, these are statistics, these are what we know, and it's just getting worse and worse. So my question is, as far as our brain health is concerned, what is happening inside our bodies when the possibility of stroke could possibly be developing?
What is happening? That's a big question. There's so many things happening, and it depends on the type of stroke and the cause. There's so many. Stroke is not a monolith. We mean in neurology so many different things when we say stroke. But for simplification, let's talk about, ischemic stroke, because I think that's really what we're talking about. What's happening is that our arteries are getting blocked for one reason or another. Really, that's the underlying mechanism for ischemic stroke. And the blockage in many of us is caused by accumulated wear and tear to arteries over time. And so that's really the crux of the question. And no, we don't have the answer per se, because there's no way to really answer that question on a population level, because there's so many different ways that arteries can become injured over time. But accumulated injury to blood vessels over time that eventually leads to blockage. That's what the problem is.
I see. I see. So is this tied through the heart first? Is this just a blockage in general? Like, explain to us, where do we start to see a lot of that blockage?
So our arteries are from head to toe, right? And so the blockage is from head to toe. When we're talking about stroke specifically, we're talking about the arteries that lead to the brain, but that's not to say that those are the only arteries that are being injured and eventually blocked. Those are just the ones that are being injured and blocked that lead to stroke, right? And so there are other arteries that can become injured and blocked, and they are, right? Often it's head to toe simultaneously at different rates, depending on what artery we're talking about. Some are bigger, those are harder to block. Some are tiny, those are easy to block, blah, blah, blah. But if there's blockage and accumulated injury in the heart arteries, that's when we talk about heart attacks, right? And so on. So when we're talking about ischemic stroke, we're talking about the arteries that lead to the brain.
This is good. And the reason why I just stayed a little bit on stroke for a bit, because it's definitely one of those things that impact us greatly. But I do want to expand out more around the brain in general. Just with, those are one of those key things that we just want to start with so people are well aware. But I also want to talk about neurological decline. At what age do those things start happening? I really want to get, because I have you, I might as well get you on everything brain related. At what age, I'll repeat the question again. At what age do we start to see neurological decline?
So again, a hard question, impossible to answer. Human beings are not a monolith. So neurological decline in me is going to be at a different age than neurological decline in you, given our context, genetic and environment, and their combination, right? And so at what age, that's impossible. But we'll say, cells, our brain cells, let's just stick to the brain for a second. Our brain cells mature over the age of 0 to 26 ish. And after that, they start to decline, right? So that's just what aging is. Aging means decline.
Yes,
So,
absolutely. So my thing is, if our brain cells are declining, right? Are there anything that we're feeling, anything that we should be paying attention to and understanding what that looks like? I really want people to understand that brain health is imperative just as much as anywhere else on the body. Like, we should be tending to our brain health. So tell us, is there anything that we're feeling, anything that we should know?
there's so much that we should know, so little that we're feeling. And that disconnect is the problem, right? Because we pay attention to things that cause us to suffer. And a lot of times, decline is silent until it's not, right? And so, tons for us to know. And so, hopefully, I can bridge that gap a little bit today. Less about what we're feeling, right? Because generally, when we're feeling it, we're later into the process than is ideal, right? To start being intentional and proactive. So I'll leave that answer there for now.
No, I totally understand, because I think the reason why some of the questions that we do ask is because these are not anything we're typically thinking about on a regular basis. We're never
Right.
thinking about our brain health. We're never thinking about the possibility of stroke. We're never thinking about the decline, especially if we're younger, right? This is far from our mind. But what we are starting to see and realize is that there is decline happening. There is preventative ways. And I feel like, let's talk a little bit to aging, right? Let's talk a little bit more about Black women that are aging and they realize that, okay, they're feeling more of that brain fog, they're feeling more of that energy loss. And I know definitely around the time of menopause and things like that, we do tend to feel that our bodies are shifting and changing. What's happening with our brain during those times?
Yeah. And I want to even take us a little bit earlier in the timeline, right? Because we can talk about perimenopause and menopause, but now we're in our 40s and we've missed 15 years of being proactive and intentional about our health. And that gap is going to lead to those symptoms that we're trying to avoid, right? And so, generally speaking, the knowledge gap really, I think, can be filled with understanding that hypertension is, the biggest modifiable stroke risk factor, the biggest modifiable health decline risk factor. Generally speaking, that's silent, right? For the majority of folks, for the majority of their lives, high blood pressure is a silent problem. But that silent problem is slowly and gradually eroding our arteries over time. And eventually there's going to be a tipping point, right? And that erosion is going to lead us somewhere undesirable. And so we got to talk about what we're doing when we're 30, right? And so what we're doing when we're 30 is hopefully listening to this conversation and understanding that now is the time to pay attention, right? Now, and I will also caveat this in saying that high blood pressure is more prevalent in Black people, more prevalent amongst Black women. And so you were talking about increased incidences in stroke deaths in this population. There's a reason, right? And so we got to start understanding the reason and being proactive about combating the reason. 30, not 45. Okay. And so I'll leave that one there.
So that leads to a really strong question there. So let's say we've missed our 30s, right? We're in our 40s, we're in our 50s, and we're not showing any symptoms of anything like dementia or even a stroke. What can we do from now? I think that's a really
Yes,
strong question because I never want anyone to think they missed the boat when it comes to controlling
exactly.
their health. But I do understand that preventative early on is always the best route. But if we're just hearing this for the first time and we're 45, 48, 50,
Mhm.
60, what does
Yeah.
that look like?
The answer is the same when you're 30 and when you're 45. The answer is the same before you're symptomatic, right? It's understanding what your biology is doing today. That's the answer, right? And the easiest way is, to go see a doctor, which you think that would be straightforward and everyone would be doing, but we're not. Generally, we don't go see doctors as much as we should because we have lives to live and we have, struggles to survive, right? And so, again, you're 30, you're 46, you're 59, you're asymptomatic. Thank God, right? And now is the time to understand what is my blood pressure. Maybe I've had high blood pressure for the last 20 years and didn't know it, right? Because I didn't see a doctor regularly and etc. And so right now we have to understand what our biology is doing today. And so it's not just a blood pressure, it's a comprehensive biomarker screens. We can understand what is my inflammatory, biomarkers saying, what is my thyroid doing, what is my insulin level saying about my metabolism and my health generally. And then once you know, then you can do, right? So we don't stop at knowing. We don't stop at, a doctor telling us that our blood pressure is a little high today and we just, park it somewhere in the memory bank and keep it moving. We have to actually do. And so that's what I'd say. 30 or 59 or 72. We got to know and then we got to do.
Okay, so that's the strong one. So, what is the science saying as far as what are some of the key things that we could be doing? I mean, I'm sure people are learning more about creatine. I'm sure people are learning more about supplementing fish oils and things of that nature for brain health. I know there's a lot of stuff, but coming from you, what would you say are some strong things that people can incorporate into their daily lives that actually helps with brain health?
None of that.
Okay, okay, you heard it here first. Confirmation.
So that's
Okay,
the
so what
thing.
is it?
I think the landscape has gotten a little noisy, right? And so we've overcomplicated things. And really, the answer is the fundamentals. The answer, the four pillars that have always been, right? So, what should we be doing? We should be eating the right things. We should be moving our bodies in the right ways. We should be sleeping enough and we should be attending to our stress and our mental emotional well-being. Those are the fundamentals. Those haven't changed. Those have nothing to do with supplements like creatine or fish oils. Okay, there's no quick fix here, right? So we're talking about processes that start when you're 26 in many, and these processes aren't going to be reversed or stopped with fish oil, right? So you have
Right.
one, you got to understand what you're dealing with. That's got a lot to do with your genetics. It's got a lot to do with what your mom and dad and your grandma and your granddad were facing that they passed down to you. And then we have to figure out the environment piece. And the environment piece is the movement and the sleep and the what we're consuming, whether it's, you know, helping or harming, and the stress. Stress is huge for Black folks, especially Black women. So the fundamentals, that's what we do.
I like it because you know why? It brings us back to the very basics. And the reason why I mentioned those things is like that is what's pumping through social media, through
Yeah.
all of the things that we should be doing and holding on to. But what I want the audience to understand and know is that you guys are the specialists in this. And if you're saying that the noise is noisy, and we're paying attention, we're buying all these supplements because people are selling us things to fix an issue or a problem, when you could be taking all the creatine, you can do all of that. But if you're not sleeping at night, if you're eating garbage, it doesn't help. So your confirmation was key. So I want to talk a little bit more also about the brain as far as fog, all of the things that impact women in general. I'm getting all of my brain questions out because this is something that even for me, I'm seeing a lot more of that as I'm getting older. A lot of brain fog, more headaches that are happening due to the fact of rise and fluctuation of hormones, all of those different things. So I want to talk to all the symptoms that Black women feel with their brains at the moment. So my question is, can you tell us a little bit about what's going on with the brain when we have those type of fluctuations, when the fog comes in? What does that look like?
Yeah, so it looks like different things depending on why the brain fog is happening. I recently, I don't know, there was a piece that came out about brain fog that I commented on. Um, but anyways, brain fog is a symptom. Brain fog isn't a diagnosis. And just like every other symptom, like dizziness or I don't know, headache, there's a reason. And the reason could be I'm bleeding in my brain, or the reason can be I didn't sleep well last night. And those are very different things. And so I just, and that's the that's the value of a neurologist. Because we can understand the nuance and then we can guide you. But that's just a preface. I actually want to answer your question in a way that's of benefit to you. So I will say hormone fluctuation as a cause of brain fog is real, right? Especially, at the onset of perimenopause. And what is happening, our bodies are run on cycles that are driven by hormones, right? And so, I mean, that's the long and short of it. So if our body is used to stability and now all of a sudden there's instability, then the body's going to notice. And a lot of times symptoms are just the body communicating that it's noticing something, right? And so in the case of hormone fluctuations in midlife in women, there are sex hormones like estrogen and progesterone that shift, right? And those shifts actually cause changes in non-sex hormones like cortisol and etc. And shifts and fluctuations in cortisol cause rapid and significant changes throughout the body, depending on, your baseline. And so a lot of the times what we're seeing is not just, ooh, my estrogen is low now, but it's, okay, what is the downstream effect of that? And a lot of times cortisol is our body's way of saying, I'm stressed out, right? Rising cortisol and persistently elevated cortisol levels, that's the body's way of saying that. And when the body does experience that, myriad symptoms can arise, from brain fog to headaches to high blood pressure, worsening blood pressure that was already high that we were unaware of, right? Above a certain threshold, a high enough blood pressure is going to cause headache. A high enough blood pressure above a certain threshold is going to cause dizziness. It just depends on the person and the context and the nuance, but that's my roundabout way of saying, yes, your experience is legitimate and I honor it. And it can have downstream effects, these hormone fluctuations that lead our bodies to respond with symptoms that are really just noticing, if you will.
So I like that you said all of this because it really does tap on a lot of what we should be understanding that our brain is going through. And I think when we have that kind of information, we kind of are a little more empowered in what we say is going on, because I know brain fog impacts a lot of women. It is one of the hardest. Is there anything that we can do when we experience brain fog? What are some things that make the brain happy?
You
So
know
it's
what
not
I'm going to say.
fogging.
You know what I'm going to say. You got to talk to your medical provider, okay? Because
Mhm.
brain fog is a symptom. It's a symptom of something. And we are partners in your health. And so we understand the science and the nuance. And so we can get you to a place of knowing what really underlies that symptom. And it's impossible for you to try to take all that on your own, right? You're busy living your life and surviving, raising a family and, taking care of X, Y, or Z. Why become a medical expert too? Right? Just delegate.
That's perfect. So, my question is, what are some great questions that we
Yeah.
can ask our doctors pertaining to what should we be armed to know, especially like if we're sitting with someone such as yourself? What are those key things that we should be asking or getting information about?
Yes, and I want to even take it a step back. I think as patients, I'm a patient too. As patients, our job is to notice what we're experiencing, right? And I would encourage everyone to write it down, right? We've all got phones as our fourth appendage. So write it down. I experienced this on this day. It lasted this long. These are the things that I experienced with it. So just bring the history. We could do the rest. Once you've brought the history, we're going to ask you questions that are necessary to get us to pinpoint the underlying cause of this thing. But your your my best advice is to understand what you're experiencing and bring the full report of it, because that is golden, right? You don't understand how often I'm sitting in front of someone who's got nothing for me, right? I've got no details, right? As a specialist, a lot of times, we find ourselves with patients in front of us who don't even know that they're seeing a neurologist or why. So, I mean, for folks who are intentionally consuming expert care, I would say come with the details. You know what you're experiencing, catalog it, and come with the full story. And that's, I think, the most advantageous thing you can do. And the other thing you got to do is come, because you don't know how often we just grin and bear it. We just suffer through it, and then time happens and things have accumulated, and now they've snowballed, and now it's an emergency, right? And so make note of it, catalog it, and come, show up, get help.
I like that. I like that. So my question is this: is there any particular trend that you see with Black patients when they visit the neurologist? Is there something that you wish that they would know, or something that you always tell them to know? Anything around those perimeters?
Trends that I see with Black patients who visit the neurologist. You know what? Again, I see so many patients in a week of all hues, and I'm always empathetic to, especially my older Black patients who are just reluctant consumers of health. And so it comes back to what we just talked about, right? Catalog it and go. I have folks who, they'll be so gracious and grateful after we've spent time together and they've, developed an ability to trust at least a sliver of the healthcare system that is me. There's me's everywhere, right? And so just go. And if it doesn't feel right the first time, go somewhere else, right? But don't stop. Catalog and go. Yeah. Especially for us, because there's this, especially in our older folks, there's the reluctance to engage. And the reluctance to engage, is justified, and there are reasons, for it. And our lives depend on it. So we have to find a balance. And if it takes us trial and error, a couple of providers, then it takes us trial and error and a couple of providers.
Absolutely. And I know that one of the key things that we've discussed a lot is access to care as well. I know there are certain places in the United States where it's very difficult to find a neurologist, especially one that looks like you or understands your specific needs. And that's why, these are such great conversations to have. Thank you so much, Dr. Adoko. I'm happy to have had you. I really wanted everyone to kind of hear a little bit about, because I didn't want to leave any part out. I wanted to make sure that we at least covered what our brain is doing, what we need, and of course, the importance of stroke prevention. As a matter of fact, everything that you've mentioned actually helps us prevent stroke. Now that we know it's our metabolic panels that we need to look at, it's definitely making sure that we understand our blood pressure, what our body is doing, any symptoms that we're feeling, we log it down, provide our doctor those answers and answer their questions so it allows us to get the proper help that we need for our longevity and to prevent stroke. Thank you so much once again.
Thanks for having me.